Hello, everybody, and welcome back to Plugged Into Public Health. I'm Lauren Lavin, and if this is your first time with us, welcome. We're a student-run podcast exploring critical public health topics that matter to everyone, whether you're deep in the field or just curious about how public health shapes your world. Today's episode features an insightful conversation with Dr. Deshpande, Clinical Associate Professor in Epidemiology at the University of Iowa College of Public Health and current president of the Iowa Public Health Association. With a career that spans state health departments, academia, and public health advocacy, Dr. Deshpande brings a powerful lens to how we train future professionals, navigate funding challenges, and engage in policy advocacy at the state level. As listeners, you can expect to walk away with clear, actionable advice, from how to build advocacy skills as a student to the small but meaningful steps each of us can take to support a healthier public. Whether you're wondering how to stay motivated in a tough job market or looking to get more involved in shaping public health policy, this episode offers some practical wisdom for your next step forward. So let's get plugged into public health. Plugged Into Public Health is produced and edited by the students of the University of Iowa College of Public Health. The views and opinions expressed in this podcast are solely those of the students, guests, hosts, and contributors, and do not necessarily reflect those of the University of Iowa or the College of Public Health. Well, welcome to this episode. We have Dr. Deshpande with us today. And to start off, could you just introduce yourself and a little bit about your journey to public health?
Absolutely. So my name is Anjali Deshpande, and let's see, my journey into public health. I started as an undergraduate student in microbiology, and so very much into science, lab science, and so on. But I was also really interested in like anthropology and culture and society, sociology courses, things like that. And as an undergraduate, I didn't really know kind of what options I had. I really thought I was going to be in like bench science kind of work. And so after undergrad, I started a graduate program in microbiology and had the opportunity to take kind of a disease and society type of course, which I was like, where has this been all my life? And it really was, kind of that public health and epidemiology course. And at that time, I was able to sort of change paths. So to move from kind of a basic science microbiology track to public health. And so I did an MPH, and in my MPH had the opportunity to work at a state health department in Oklahoma for my practicum. Loved that, but wanted to really dive deeper into epidemiology, and so went on and got a doctorate at Emory, and that was kind of my intro, I guess, into public health and kind of what I wanted to do after that.
Where were you born and raised?
Well, I was born in a small town in upstate New York, Wappingers Falls. It's near a place called Poughkeepsie. A lot of people have heard of Poughkeepsie, New York. So grew up there, yeah, and then went to college from there.
Where'd you do your undergrad then?
I went to Cornell University in Ithaca, New York to do my
Okay.
undergrad.
And so then how did you end up in Iowa?
Yes, well, that is an interesting question. So I've actually lived all over the United States. As I said, I did my master's in Oklahoma, then I went to Atlanta to do my doctorate, and then we moved to Missouri. And I was in St. Louis for 13 years, most recently at Washington University at their School of Medicine. But while I was there as a researcher, mostly in cancer prevention and control work, I saw an opportunity at the University of Iowa to direct the MPH program. And this was back in 2016. And it was just like, oh my gosh, that's my dream job, to be able to get back to working with students, to really kind of focus on public health and public health practice. And it was funny because I had a mentor at WashU who did his training here in Iowa, and he just spoke so highly of the program and the people and just living in Iowa. And I used to kind of laugh at that. But then when I came and I met the dean at that time, Sue Curry, and people in Iowa, really was impressed with the collegiality and I don't know, I really liked it. So we moved here and I've been here since 2016.
What specifically drew you to working in this state and then also like staying, right?
Yeah. Well, an advantage of being in Iowa, I think, is it's a small state, which from a public health perspective can be a big advantage. So, for instance, being at the college, you can really reach out and learn about other organizations. You can be involved in those other organizations. I'm sure we'll talk more about the Iowa Public Health Association here
You know
eventually.
it. Hmm.
But that was one thing. So I joined IPHA really early when I moved here because I thought it's a small state. I can get to know the people that are working in public health. I can get to know who the players are, kind of what the landscape is, and so on. The other thing that I liked, and it was funny because when we came to look at possibly moving here, my children were kind of in school, like elementary and middle school, and they were very impressed with how diverse Iowa City was, which is kind of funny, thinking about that. We don't think of Iowa as being diverse, but it really is. There are pockets around the state, and you have an opportunity to get to know different communities and different organizations, as I said earlier. And so that's one reason why we came and why we've stayed. The other thing is, I feel like you can feel an impact of the work that you do. You can see how what you're doing connects to what others are doing. And that's a reason to stay. And I don't think we thought we would be here, 9 years later, but I've been able to do a lot of really interesting things and I think most importantly, be able to kind of carve out my path and my career in a way that I wanted to, not necessarily, kind of what it might look like or supposed to look like, for other people. So that's been fun too.
I love that. As someone who's been born and raised in the Midwest, it's nice to hear how other people view it after, coming to it a little bit later in life.
Yeah.
So, like you mentioned, we are going to talk about the Iowa Public Health Association, and you are the president of it. What does this role mean to you personally and professionally, and how long ago did you get the role? Just orient the listeners.
Sure. So, as I mentioned really briefly, kind of in my background and so on, right from the beginning of working in public health or learning, studying about public health, I had the opportunity to work in state health departments. So first during my practicum as part of my MPH degree, but then after I finished my doctorate, I mentioned that we lived in Missouri. We moved there for my husband's work, but I had an opportunity to work as an epidemiologist at the Missouri Department of Health. And so throughout my career, I have really been linked with state and local public health departments. So when I came to Iowa, as I mentioned, I joined IPHA early on as a way to kind of know what was going on, meet the people, who were around the state. But in joining IPHA, I felt like that was a way to keep one foot in that public health practice space. And so even though I was at the college and I was directing the MPH program at that time and engaged in research and so on, it was that way to stay connected to practice. And so that's kind of how I started there. I also, in my role as an educator at the college, I oversaw some of the educational and professional development activities of IPHA. And so, that was an opportunity as well. The way IPHA works, you can become a member. You can eventually join the board. I served as secretary of IPHA early on. Then you can serve as president-elect for 2 years. Now, as of January this year, I became the president of the board and will serve for 2 years, so for 25 and 2026. And then you get to serve as past president as well. So I've been pretty involved for a number of years now.
Yeah, a long time coming, it sounds like.
I think it's a good way to get your sort of understand what the organization is about, get to know what's going on in the state, and kind of figure out like what are the priorities and what things do you want to be engaged in as a leader in the organization.
So, what are your top priorities as president of IPHA right now?
You may know, but for your listeners, PHA's overall mission is to unite and strengthen the voice for public health in Iowa. And we do that through a number of ways. the primary way is to strengthen public health practice. That means training, professional development, education for the workforce. The second strategic area is really to build a public health movement. And we want to do this through advocacy. So, not only as an organization, but how do we teach local public health practitioners, community members, legislators, how to advocate for public health and the principles of public health. We do, as a nonprofit organization, do some lobbying at the Capitol, but most of what we're doing is advocacy, and I'll mention a little bit more about that in just a minute. And then the last thing is we want to make sure that as an organization, we have the infrastructure and capacity to continue to move public health activities forward, that we have a diverse leadership, that we are financially, sustainable, and all of that. We're here into the future as well. Going back to this idea of advocacy, one of my priorities as board president is really to build those advocacy muscles in our organization. And now, certainly within our staff and even within the board, we have people who have worked in that space for years, have done like community organizing or advocacy kind of work. But we really want our members to start to build those muscles as well so that they can work on the local level as well. When we think about sort of what influences public health, right now, we're certainly thinking a lot about federal actions, but it's really at the state and local level that IPHA wants to focus our efforts because, things that are happening in the legislature in Iowa, things that are happening in local communities in Iowa is what is going to impact Iowa communities the most.
I love how you framed that as building a muscle because that is truly how it is. You have to practice it in order to get better and feel comfortable doing it. And repeated action for that, I would say for advocacy in particular, is so beneficial when you're looking at trying to make change. It just takes a lot of small steps.
Yeah, no, that's a really important point, and I want to kind of lift that up and echo that a little bit more because a lot of times when we think about how we can influence policies, how we can influence, decisions that are being made, we think about voting, right? And we think about voting is the way that we're going to make our voices heard. And that's absolutely true. But that happens, at specific times, right? So every 4 years we elect a president, every 2 years we elect Congress people, and so on and so forth. But there's so much work that has to be done in between those elections as well. And that's where IPHA, that's where the membership of IPHA can really build those skills and use those skills. It's not just about having a conversation, in November of an election year. It's about having those conversations, about sharing the data, about telling stories about what happens all the time and in all kinds of different places.
Yeah, absolutely. What do you see as some of the biggest public health challenges that Iowa is facing today?
Well, the past couple of weeks have really kind of highlighted some of those challenges. I think, the number one challenge that public health faces right now, both nationally, but here in Iowa as well, is definitely funding. And this is not a new challenge that we face, but it has come, it has been thrown into our face in big ways that funding is something that we're going to have to think about. I mean, in the past couple of weeks, the federal government has called back from states COVID money that states got to the tune of $11 billion across the country. Well, Iowa was impacted by that too. And, this number may be slightly off, but it's my understanding that like the state had something like over $100 million of that money that now is going back. So that means that money is no longer here in the state to be used for public health or anything else. So funding is huge. The other piece with that, with regard to funding, is we think of cuts happening at the federal level, but those grants and that money that comes into the state means that jobs in the state, public health jobs, research, science jobs in the state are now being cut. So different organizations are going through kind of reduction in force movements. And that means that people in Iowa are going to lose their jobs as well. So the money aspect hits in many different ways. The other piece of that I think is a real challenge is as some of those public health professionals move away from public health, will we get them back? So maybe this is like a very time limited kind of issue or time that's happening. But as people move to other organizations, will they come back? Students like yourself, like, people that were training in the college, will you have jobs available to you? What will those jobs look like? And if you go to other kinds of sectors or other kinds of jobs, will you come back to public health? The other thing that I used to think was, governmental public health is not the only way that people can have careers in public health. There are a lot of non-governmental organizations, there are a lot of different ways, but a lot of those organizations are funded by the Centers for Disease Control and Prevention, right, through grants and contracts and things like that. And so if that money is tightening, the opportunities are fewer. And then even if those organizations still exist, some of the funding cuts have resulted in internship programs being dropped, other training kinds of programs being dropped. I really worry about young people right now and their careers and what that looks like. Now, that's not to say that there aren't opportunities, and I do think that this will kind of work itself out, but right now it's really hard, and I particularly feel for young people who they went through COVID during their education, and now they're going through this as they're looking at careers.
I hadn't really thought about if they find something else to do outside of graduation, will they come back to public health? I can see how that could be a real problem because then you've built this whole new set of skills that serves you well for the rest of your career. I think it could be hard then to come back, but then we're going to end up with a shortage of public health professionals.
So both from, right now we're going through this period of public health professionals that are retiring, and a large number are retiring. And the number of people coming into public health has in some ways increased a little bit after COVID, but it's leveled out in sort of the last couple years. So that's one thing. The other thing is, public health, you're not going to get rich for the most part in a public health career. You're doing it because you're committed to the principles of public health. You're committed to the community aspects and the impact that can be made. People can probably make more money, right, in other kinds of careers or in other sectors. What we love about students who come into public health is not only are public health students smart, right, because many of them had, backgrounds in science and economics or psychology and so on. So they're smart students, but they're really committed to making a difference. And I can't blame people. I certainly don't blame people for considering other options now, right? We have to take care of our families. We have to think about our futures. We have to pay off student loans and all of that stuff. But I just hope that we can create a space, we can create some safety for the next generation of public health.
What advice would you give to students that are hoping to stay in this field and make an impact in public health, even given like the surroundings of or the context of the situation right now?
I teach the Introduction to Public Health class for MPH students, and one thing that I tell students all the time is motivation and initiative are hugely important, right? So your coursework obviously, is critical and so on. But if you have an interest in public health practice, if you have an interest in public health research, like whatever you think you might want to do, step out of your comfort zone, introduce yourself to people, get involved in organizations like IPHA. You might also get involved in organizations that are more discipline specific and get to know people. A lot of career building is about building a network and the people that you know, and having people think about you as somebody who has skills or who has initiative and so on. Nobody's path is particularly linear. You'll try something, you might try something else, but all of those opportunities are help you to build skills, help you to figure out what you like and what you don't like. Now, there are a lot of opportunities to volunteer, there are opportunities to get involved. I know that it's hard for students. A lot of students are taking on debt to get a master's degree or even to get an undergraduate degree. So doing volunteer work, is not always feasible. You need something that is paid. But if you can get involved, even to a small degree, even at the college, like with the strike force or with research opportunities that are happening, try to do that because that's going to help you build some real world skills, help you to apply what you're learning in the classroom, and help you start to meet people who, you may be reaching out to down the road.
I think that kind of touches to the interdisciplinary nature of public health and how being in your community is so important, which I want to circle back quick to IPHA and kind of that community component. How does IPHA kind of help to bridge those gaps between communities and policymakers and public health professionals and even students to kind of create this holistic, well-rounded view of public health?
Yeah, we try. And I have to say that we have 3 staff members right now who really do a lot of this work. And so what IPHA can do is we often act as a convener. So our role is to get the right people to the table who can then move something forward and make things work. And what we often do is we're not very topic specific, and that's not to say that, we don't advance things that are focused on immunization or focused on injury or focused on women's health. We can do that. But overall, we're really trying to figure out, again, like how do we prepare the workforce? How do we make sure that the workforce has the skills that they need? We do some educational kinds of things. We do some trainings. In fact, we just had the Public Health Conference of Iowa, wow, last week. And so we did a pre-conference workshop there on this idea of advocacy and power building and building a public health narrative and so on. We do a variety of things throughout the year. Additionally, we have opportunities for students that are practicum, internship type things. We have like AmeriCorps positions and other types of fellowships. And so we are really involved in trying to do that. But I want to stress that IPHA, being a small organization, we have to also know kind of where we can have influence and where it's up to somebody else to move something forward. And so we want to be the convener. We want to advocate for public health. And right now, that means that we might be taking on things that others cannot be doing. For instance, we can still talk about health equity. We can still talk about the importance of understanding what's happening in communities and studying health disparities and thinking about what interventions are really needed by different communities. That's not the case for other organizations in the state right now. And so we need to make sure that we are understanding like what the needs are in the state, what others are doing in some of those spaces, and where we can help fill in the gaps by bringing the right people together, by having conversations. And you mentioned about legislators. We also think that it's important for us to bring, especially new or emerging leaders in the state, together to talk about what public health is and how policy that happens at the state capitol can impact the health of people, right? It's not just about, what the vote is on Medicaid funding. That is certainly important, but it's also how, voting on education impacts the health of the communities, or voting on other kinds of policies about farming or about transportation impact people's health as well. So we want to help people to understand those different things. We want people to understand how social determinants influence health outcomes, how different communities within our own state, again, have different risks of poor health outcomes, and how that work needs to be done.
Basically, Iowa Public Health is bringing everybody together. And if our listeners resonate with that mission or want to support IPHA, is there any way that they can get involved?
Oh, absolutely. Students can become members of IPHA. We have a special student membership. I'll get back to that in just a moment. Students can join any of our committees so they can be involved. If our probably the most active committee that we have is our advocacy committee. If students want to get involved there are ways that they can do that. As I said, there are opportunities for internships or for other kinds of work like that. So that can be really important. Getting back to this idea of becoming members, it's particularly important for our students in the College of Public Health to know that the college will help to support you to be a member of IPHA. So I think membership for students is like $35 or sorry, maybe it's $50 now, but the college will pay for your membership while you're a student. So that's, there's no risk there. You can apply to be a member, pay the fee, fill out the form in student services, and you will get that reimbursed. The other piece of that is the college helps to fund students to attend the Public Health Conference of Iowa or to attend other conferences or trainings and things like that. So again, it's an opportunity for students to reach out, to try something different, to see what's going on outside of the college and to take part in that. Again, low risk. The college is willing to provide funds. So there's really no excuse not to be involved. But, and certainly students can always reach out to me as well if they're interested. I'm always happy to talk to students about public health practice opportunities, to talk about IPHA. And we haven't really had a very active, like, student section or student membership IPHA. But again, going back to what we said about advocacy and kind of building that muscle and one step at a time, now is the perfect time to start to learn. How do I have these conversations? How do I take what I'm learning about public health and talk to other people about it? How do I create the kinds of materials that people need? And you mentioned earlier about the kind of multidisciplinary, interdisciplinary approach to public health. My students, will hear this and maybe like laugh or roll their eyes, but public health is a team sport, right? We need everybody from all of the different disciplines, from all kinds of different backgrounds, to come together to do this work so that we have that perspective from different angles, from different approaches, and can really make what we're doing make a difference. And in public health, we say that when public health is working correctly, what we do is invisible. And that's true, right? We know that. It's when something goes wrong, all of a sudden we're like, oh no, there's an outbreak, right? Or there's contamination of water or something like that. Right now, public health is at risk. We've talked about the funding issue. We've talked about the public health workforce aspect. We need to make our work visible, right? We need to make people understand that the clean water, the clean air, healthy babies, active, vibrant older people, all of that is because public health is doing the work in the background. And that's not to say that the clinical care is not doing the work or policy is not doing the work or those things, but public health makes a difference every day. So we need to make sure people understand that.
That comes back to the idea that like being out in the community, being good advocates for public health is just so important for students. So any opportunity that you can get to practice that is just so important. And it's going to be beneficial not only for your career, but in getting the work of public health out there so that it isn't forgotten about, except for, in times of need. So
Absolutely. Yeah. And it doesn't have to be something big. Like sometimes we think, oh, it has to be this big, really momentous thing. Small things, doing small things one after the other, that is what helps build confidence. It helps build, your ability to do things. And and it's scary. I mean, even for me, I've been in this area, for a long time, but I haven't necessarily been out advocating, talking to others. So it can be scary. But that's okay. That's what the training is about. That's why we have tools and resources to help people. That's why, we kind of use like a buddy system. You don't have to go by yourself, go with somebody else, but do it. And every time you do it, it gets a little bit easier. And in the end, as I said earlier, we're doing this because we care. We're doing this because we believe in the principles of public health. Even if somebody doesn't agree with you, even if somebody, shouts you down, or we're still doing it for the right reasons. So we need to try to get out there.
As you look ahead, what hopes do you have for the future of public health in Iowa?
I hope that we can first, I guess that we can continue to have strong public health programs. Certainly, the college is, one of the primary public health programs in the state. There are a number of other colleges and universities who are also doing training. So I hope that we can continue to have that public health education presence in the state. I hope that we can start to build more bridges and more relationships with the legislature, with the governor, and so on. After all, I mean, we all believe in the same things, right? I mean, we want people to be healthy. We want kids to be healthy. We want safe communities, right? We want communities where people have jobs and have safe places to live. The way we get there are the policy differences, that we have, but that's not insurmountable. So I hope that we can continue to have conversations and we can kind of get out of this, like you're there and I'm here and, we're never going to come together. And then I think that the more we can get the population, the citizenship of the state to understand that public health impacts what you do. It's not just some government program, or it's not just something that is trying to help one group of people. It's really about making sure that the whole population has an opportunity for better health. And that does mean that some populations might need might have greater needs than other populations because of history, because of, barriers that they face and so on. And the goal is that if everybody has better health, then what we can achieve in Iowa is just much better than what we have right now. And I think that's always a goal, right? That things are better for our kids, and there's a way to get there.
I'm getting my PhD in health policy. And so I try to remind people that in the end, we do all want the same thing, I think, for the most part. And
Yeah.
like you said, it's just those differences in how we get there. But I think more often than not, we are aligned in even that. We just need to like find the common ground.
Yeah, yeah. And right now, what's happening at the federal level, cutting of programs and all of that. Like, even though I said funding is an issue, it's not that taking a look at what we're doing and thinking about whether we're doing the right things and being critical of ourselves and what we're doing, those are things that we should do, right? We do want to be effective yet efficient. We do want to make sure that we're not wasting funds and so on. But we should be doing that in a very deliberative, reflective way so that we can explain to people what we're doing, and we can explain to people why certain decisions are being made, why certain policies are important, and so on. I think that right now there's a lot of, like, I don't know, divisiveness, but we need to think about, the safety and the well-being of everybody in our state. And that, when one person has something, it doesn't threaten what somebody else has. It makes everybody better able to work and go to school and take care of families and things like that. Again, things we all want.
Well, I'm glad we have someone like you at the helm of public health here in Iowa. So as we wrap this up, we always ask like one lighthearted question at the end,
Sure.
and on a positive note. So what are you reading or watching right now?
Ooh, okay. Could I give you two things then?
Absolutely.
Okay, so one is kind of work related. Dr. Sandro Galea is the new dean at the Washington University in St. Louis School of Public Health. They just opened a new School of Public Health. He was at Boston University as the dean. Now he's in St. Louis. He writes a newsletter that I think is weekly, but it's called The Healthiest Goldfish. And it's about public health, and it is excellent. Dr. Galea is just one of the shining lights. No paid endorsement there, but his newsletter is fantastic. So please take a look at that. One thing it's not what I'm watching. I mean, we could go there, but podcasts are something that I have really been listening to a lot more in recent years. And one that I love that I try to tell as many people about as possible is called Hidden Brain.
I listened to Hidden Brain. It's
Yes.
great.
I love Hidden Brain because, I mean, it focuses a lot on like psychology and social science and behavioral kinds of things, but so many of the episodes have something to do with public health or are, kind of talk about this idea of community and so on. And so, yes, if folks are not listening to Hidden Brain, absolutely highly recommend it.
Yeah, good reminder of how, again, like public health touches everything. So even if something isn't necessarily about public health, you see the tie-ins, especially if you're a student and kind of in it, all day. So yes, highly recommend Hidden Brain. There's so many great podcasts out right now, and they're so easy to put in while you're like doing other things. That's my favorite part is like, I love to go on a walk and listen to a podcast, and I feel like you learn so much and move your body. So
Yep.
two for
Yeah,
one.
exactly. Same.
Mhm.
Yep.
Well, thank you so much for being on the podcast today. That was so much great information, and I really hope that students are inspired and you put some of their fears to worry if that's, kind of where they're at right now and motivated to move forward and out into the world of public health.
Thank you, Lauren, for the opportunity to talk about a little bit about my background, but mostly about IPHA. And absolutely, students, the young people today are the force of the future. And so how we can get our current students together with IPHA, with practitioners out in the field to really make the case for public health, that's what we're after. So I appreciate this opportunity and thanks for doing it, putting the focus on IPHA.
That's it for our episode this week. A big thank you to Dr. Deshpande. That's it for our episode this week. A big thank you to Dr. Deshpande for sharing not only her public health journey, but also the strategies, mindsets, and opportunities that can help students and professionals alike create lasting impact, especially during times of uncertainty. Whether you're exploring how to get involved in advocacy, considering membership in IPHA, or just looking for ways to stay connected to public health practice, today's conversation highlighted the small steps, reaching out, showing up, and staying curious that can lead to meaningful change. This episode was hosted and written by Lauren Lavin and edited and produced by Lauren Lavin. You can learn more about the University of Iowa College of Public Health by following us on Facebook, and you can find this podcast on Spotify, Apple Podcasts, and SoundCloud. If you enjoyed this episode and want to support Plugged into Public Health, please share it with your friends, colleagues, or anyone who cares about community well-being. Have a suggestion or a question for our team? Reach out at cph-gradambassador@uiowa.edu. This episode was brought to you by the University of Iowa College of Public Health. Until next time, stay healthy, stay curious, and take care.